Hi, thanks for checking in with the Medical Marijuana Channel. Today we're just going to have a real basic discussion, and this will be our first video, and it's just about where the industry is at. We're located here in Florida. The changes have been fast and furious, one might say. You really have to keep up on the laws. You have to be careful if you are a patient that has been recommended or prescribed medical marijuana. You have to be careful in a lot of different ways, how you use it, where you use it, what you use, how strong what you use is, if you're using what you need to treat what your ailment is. And then there's always the, recreational user who's got a completely different focus than the medical marijuana user. And we pretty much going to focus all of our videos and all of our time on the medical marijuana user, with an increased emphasis on compassionate care for people suffering from ailments that previously were not treated or able to be treated by medical marijuana or medical cannabis. Why is that important? It's important as the industry changes. There is a huge gap between where the medical community is, JAMA, Journal of American Medicine, and where the marijuana community might be. So to try and bridge that gap, you need people that can make that leap. And it's not easy because there are so many different ailments, so many different things that could be affecting an individual disease-wise, or in the body and the chemistry of the body. And then there's also so many different types of marijuana, both strains. Now you've got flower available here in 2019. You've got different percentage of CBD, different percentage of THC. You've got different methods, whether they be inhalation, oral, vaping, and then edibles will be down the line. So just in a real quick discussion right there, you can see how many different areas and how many different avenues are affected and how they all kind of intertwine. So what we're going to try and do is take a little bit more of a scientific approach to what we're doing here. We're not going to be online, smoking weed and just kind of talking about how great it makes us feel. We're actually going to try and get some input from the people out there and try and match different products to different problems people might have. So I personally think that there's a lot of kids out there who suffer, there's quite a bit of traumatic injuries out there that people might have, whether they're head injuries or whatever, and the people suffer from severe seizures. I think that there's a lot of medical proof out there that marijuana or cannabis, whether it's THC or CBD, and I think that the data will support the CBD, but I'm not 100% sure about that, but that it stops these seizures. And some of the reports that I've seen and some of the things we've seen online, that the seizures have gone down significantly. Some kids might have 60 seizures a day and they've gone down to 6 seizures a day. So when you're talking about that, that's just amazing relief for both the individual suffering from the seizure, and it might even be equal for the person having to take care of them and see that over and over again. So there's definitely a need for what we've got here, which has finally been brought to Florida thanks to our legislature, which is medical cannabis, and we're able to use it now in its, I guess, most original and purest form. Some may argue that, but in the flower form. So this is just a real intro to medical marijuana. This is our YouTube channel. If you can, please subscribe. We're just starting out. Probably not the best video, but anyway, we will be following up with this video, our second YouTube video, which will be the process of going through the approval through your doctor and the state of Florida for your medical marijuana license or medical marijuana card, and then what happens thereafter. So Please tune in, and if you could subscribe, we would appreciate it. Take care. Hope everyone is doing well and staying healthy.